Hi, my name is Dr. Janet Miller, and I'm a psychologist here in Alberta. And I am so excited that today I get to have the pleasure of interviewing Dr. Judy Malone. Judy is the Chief Executive Officer of our Psychologists Association of Alberta and is a fantastic therapist and just a really lovely person. So I'm glad we got time together on air to talk a little bit about postpartum depression. Can you start us off by explaining what postpartum depression is?
Certainly, because it's really common that we have the baby blues, but postpartum depression is an actual clinical depression that can happen during pregnancy or up to a year afterwards.
Within a year, so it can span that time.
Mm-hmm.
Okay, so it's not just the blues, baby blues. Say more about symptoms of it. How would I know if I have postpartum depression?
Yeah, I remember having the postpartum blues, and it was a really dark time. And then after a few days or a week, it passed. What we see with postpartum depression, a clinical depression, it doesn't lift. It lasts at least 2 weeks. And in that period of time, people may have slightly different symptoms, but for the most part, they're either very, very sad or extreme irritability. And we have real changes to our appetite, our energy level, the amount of sleep we need. Those things can really increase or decrease, but we know for sure we have more difficulty concentrating, trouble with our memory. There can even be thoughts of suicide, death, dying. And many people will have either some guilt or shame that they're not feeling the joy and happiness and connection that they hoped they would with a new baby in the house.
Classic symptoms of depression, it sounds like. Is there anything different about postpartum depression?
Not really. We think it's more isolation or lack of ability to access services and people, because we know what makes a real difference is having really good social support, naturally occurring supports, places to go, things to do, people to connect with.
Okay, so it's almost like I expect myself after this new baby to feel like here with joy and connection and all those things we expect after a new child, but I'm only feeling this, right? And that creates that guilt or shame. That must make it really hard to talk about.
Well, when there is postpartum depression, treatment is really key. For some people, that means active steps to learn about what it is, make some lifestyle changes. Therapy is extremely helpful and beneficial, and maybe even medication is a good option. So exploring what options there are, what's a fit for you, is really key to shortening the length and how difficult that depression can be.
Okay, so if I'm a mom out there listening to, maybe I'm in a waiting room right now and oh my gosh, it's been hard to get out of the house and I'm here with my child and I know I'm not feeling like myself, and my inkling is this is more than just baby blues. Who can I talk to? Where can I go for help?
Ask your doctor, read online, talk to the nurse in the clinic, talk to a psychologist. We're all here to help and we've got the information. But maybe you're not the new mom, maybe you're the new dad, maybe you're the new partner in this relationship. You might be feeling the same way and you should ask also. Or you might be asking because you're concerned about your partner. Get that information. The people closest to us make the biggest difference.
My partner, say more about that. Partners are at risk?
Well, we do know that postpartum depression affects new parents, period. It's not just the new mom. It can be the partner that's experiencing the depression. So either as a partner, you want to learn more to support the mom, or maybe it's you that could be experiencing the postpartum depression. So getting more information is really key.
Okay, at risk. What might put me at risk for postpartum depression?
If you've struggled with trauma, past or present, had addiction in the past, if you're in an abusive relationship, or it's just a magical combination of the number of stressors in your life, plus genetics, your risks, maybe even biological issues like whether or not you're very sleep deprived or kind of medication you're on. So it's that combination that puts you at risk of flipping the switch essentially and setting off a clinical depression.
So it sounds like there are risk factors, especially my own personal history of depression in the past, those psychosocial stressors that you mentioned, but really anyone can be at risk if there's that much stress, or if my biology is such that when I'm stressed, this is the way it presents itself. It's not necessarily something I did wrong or something I've been, I don't know, something I need to feel guilty about.
And if you don't think you have clinical or postpartum depression, you still benefit from all the prevention measures. Your naturally occurring supports, more social time, better self-care, and talking openly about how you're feeling and doing. That'll reduce your stress.
Awesome. And there's lots of places to go for support. Your family doctor, nurses you might be in contact with, a psychologist that we know.
Someone just like you.
Or like you. Oh my gosh, please reach out for help if you can. Thanks so much, Judy. Appreciate the time with you.